A very warm welcome to all to another episode of the Hindus Wellness Webinars presented by the Kauvery Hospital. Many of us are perhaps already aware that India carries one of the highest burdens of non-communicable diseases globally, with over 105 million people living with diabetes and another 136 million identified as pre-diabetic. The two figures combined is a significant public health concern. So, on the eve of World Diabetes Day, which is tomorrow, November 14th, we bring you this webinar on diabetes reversal. Is it possible? There are many stages to and many types of diabetes, and in certain situations, perhaps a lifestyle change can slow down the progress of the disease. But is diabetes totally curable or reversible? We will hear our panelists, what they have to say, and understand the complications of diabetes, the difference between remission and reversal of the condition, the different treatment approaches, the self-care tips, and the science behind the diabetes progression. Our first speaker is Dr. Ramesh Raja B., consultant endocrinologist from Kauvery Hospital, Radial Road, Chennai. He will speak on physiology and pathology of diabetes. After his MBBS, Dr. Raja did MD from Madurai Medical College and DNB in general medicine and followed it up with a DM and a second DNB in endocrinology. He has extensive expertise in diagnosing and managing a wide spectrum of endocrine disorders. His areas of focus include diabetes, obesity, thyroid and parathyroid conditions, pituitary and adrenal disorders, bone health and osteoporosis, growth and pubertal concerns, reproductive endocrinology, including male and female hypogonadism, male infertility, and PCOS. He's also experienced in handling pediatric and transgender endocrinology, offering comprehensive and inclusive care for diverse patient needs. With proficiency in both outpatient and inpatient management, including critical care support, Dr. Raja is known for his evidence-based approach, precise diagnosis, and patient-centric care. He is committed to improving the quality of life through early detection, prevention, and personalized treatment strategies. He is a member of multiple organizations, including the Endocrine Society of Tamil Nadu, Puducherry, India, and USA. He's also a member of the Indian Thyroid Society, Indian Medical Association, and the Indian Society for Pediatric and Adolescent Endocrinology. So, welcome, Dr. Raja, and time for your presentation on physiology and pathology of diabetes.
Thank you, ma'am, for your wonderful introduction. Is screen visible, ma'am?
Yes, yes, sir.
As I am audible?
Yeah, yes.
Okay. So, good morning, everyone. So today we are going to see about the pathophysiology of type 2 diabetes and the physiology behind type 2 diabetes remission. So we know that India has been the diabetes capital of the world. So that means, so due to increasing number of diabetes prevalence in India, 1 out of 10 Indians have diabetes. So there is a tremendous increase in the prevalence of diabetes from the year 2019 to
There is some audio disturbance somewhere. Yeah.
Sorry. So
you have to unmute yourself. Dr. Raja, please unmute yourself. Dr. Raja, unmute yourself.
okay.
Yes.
So it increased to so 101 million people in 2023. So in form alarming is 136 million people are living with pre-diabetes. Pre-diabetes is a condition who are in a stage of intermediate hypoglycemia they are, if not under addressed, they invariably progress to diabetes. So we know this type 2 diabetes is the most common metabolic disorder which characterized by two important primary factors. One is defective insulin secretion by pancreatic beta cells and inability of insulin sensitive tissues to respond appropriately to insulin. So let us see about the pathogenesis of type 2 diabetes. So the pathogenesis and the risk factors starts from the intrauterine environment itself. So in a baby born with low birth weight or in a baby born with large birth weight, they are more prone for obesity and type 2 diabetes in a later stage because of the epigenetic modification that occur during the intrauterine environment. Also, in addition, when there is a strong family history of diabetes, like when the first degree or second degree relatives in suffering from type 2 diabetes, also this increase the risk of development of type 2 diabetes. So in addition, excess calorie intake and physical inactivity and inadequate sleep and poor stress management also contributes to the development of type 2 diabetes. So then let us see about the what are the association between the beta cell function and the diabetes development. So beta cell is the cell which produce insulin in the body. So about in a healthy population, the beta cell function is 100%. So when you have people with the diabetes at diagnosis, this beta cell function decreases to 50%. So this beta cell function this decreases to 15%, 50%, whereas the beta cell mass was decreases to 40%. So this beta cell function at the time of diagnosis is already is reduced. So we can, by following the appropriate lifestyle modification and pharmacotherapy, we can preserve this beta cell mass and beta cell function, thereby helpful to control diabetes, or we can uh, remit to pre-diabetes or normal healthy people. So what are the characteristics of diabetes phenotype in Indians? So in Indians, when compared to the Europeans, we are developing diabetes at the younger age. So we have higher baseline HbA1c at diagnosis. So we have developed diabetes at lower BMI itself. Even with a normal BMI, we are more propense to develop diabetes. So we are also more prone for postprandial hyperglycemia due to high carbohydrate intake in our country. So we also develop more diabetic complications at a younger age. So all these characteristics indicates that India is called as the diabetes capital of the world. So previously we know that diabetes was considered as a chronic metabolic disorder which was inevitably progressing and requiring increasing number of oral anti-diabetic drugs, finally eventually requiring insulin. So because of current scenario and current world, because of better understanding of the pathogenesis of type 2 diabetes and diabetes remission, we modify the type 2 diabetes definition. It is a potentially reversible metabolic disorder precipitated by the cause of chronic excess intra-organ fat. It is the fat accumulation in the liver and pancreas that contributing to the development of type 2 diabetes. So what is diabetes remission? So diabetes remission is the HbA1c. HbA1c is 3 months average blood sugar. If it is less than 6.5% without any diabetic medications for at least 3 months, then it is considered remission. So what are the interventions that are useful to make the people with diabetes undergo remission? One is lifestyle modification, another one is pharmacotherapy, another one is surgery. Surgery means it's a bariatric surgery. So when we know that what is the timeline that we know that at the time the type 2 diabetes is a fully reversible syndrome. The first hint came from 1995. That is Boris et al. He demonstrated that obese people with type 2 diabetes, when they undergo bariatric surgery, they have this leads to diabetes remission. When these people with undergone bariatric surgery, even after 10-year follow-up, almost 90% of these people remain free of diabetes. So this is the first study. It shows that the bariatric surgery makes the person with the type 2 diabetes, it leads to remission. So at that time he coined the term, who would have thought it? Now operation proved to be the most effective therapy for adult onset diabetes mellitus. Then after 1995, then 2008 only we know that the person Roy Taylor, he introduced the term twin cycle hypothesis based on the research about this bariatric surgery and type 2 diabetes remission. He shows that there is normalization of insulin secretion after bariatric surgery. Based on this, he developed an hypothesis of the etiology and pathogenesis of type 2 diabetes. What is the twin cycle hypothesis? The twin cycle hypothesis means, so when a person who have excess calorie intake and sedentary lifestyle in a background of family history of diabetes or other risk factors that I already mentioned, so this person, when there is this excess calorie intake, is converted into fat. This fat is initially deposited in the subcutaneous tissue, which is present in the peripheries like extremities, upper limb and lower limb. This subcutaneous fat does not cause any harm. However, so in some person, this over a period of time, this fat go and deposit in the internal organs like liver, then followed by pancreas, which leads to toxicity. So thereby leads to insulin resistance and beta cell function. Finally leads to the development of type 2 diabetes. So it is a fat accumulation in the liver and pancreas that contribute to the development of diabetes due to excess calorie intake, which leads to excess weight gain. So diabetes remission means, so when these person with type 2 diabetes will undergo a good intensive lifestyle modification and calorie restricted diet, so this induces weight loss. Because of this weight loss, the fat already present in the pancreas and liver get burned out and losses. So that this liver and pancreas regain its function, that leads to normoglycemia and proper insulin secretion. That makes the person undergone diabetes remission. See, it's one of the MRI, color coded MRI. This is first, this MRI shows the liver. A person with type 2 diabetes with the MRI liver shows excess fat. So after weight loss, the fat resolution is very good. So this leads to say that the liver fat is very much lost, that contributes to the diabetes remission. So that finally says that increased liver fat, increased pancreas fat leads to insulin resistance and beta cell dysfunction. So remission, when it occurs, means when there is weight loss, there is decrease in liver fat, decrease in pancreas fat, which leads to the diabetes remission. Another important term, we have to know that personal fat threshold. That means, so we know that that type 2 diabetes occurs, we thought that type 2 diabetes occurs only in obese people. It is not always. The diabetes also occurs in people with normal BMI also. Why these people with normally also develop type 2 diabetes? This is explained by the hypothesis personal fat threshold. See, here there is a 3 men at 45 years. It's a front row. So who all these 3 have type 2 diabetes? When these 3 men at 25 years of age, see, he is lean, but when he gain weight, for example, around 10 kg over a period of 20 years, so at 45 years he developed diabetes. Still he is normal BMI, but he developed diabetes. Here, a person with a normal BMI, when they become overweight, they develop diabetes. Similarly, the person with obese, the further their weight gain can cause diabetes. So these all patient normal BMI, overweight, obese, all get will diabetes. It depending explained by the personal fat threshold. What is personal fat threshold? The personal threshold is, so this is genetically determined. So some person, for example, a person with the normal BMI also get diabetes because their personal fat threshold is very less. They have the high tendency to uh, leads to fat accumulation, even a slight increase in weight gain in the liver and pancreas that leads to the development of diabetes. So some person who are more obese may not develop diabetes because their fat threshold is very high. So they may these fats preferentially deposit in the subcutaneous tissue that does not lead to development of diabetes. Only that fat which accumulated in the liver and pancreas will lead to the dysfunction of liver and pancreas that leads to diabetes. So this was explained by this diagram. See, a patient with type 2 diabetes, when their weight loss below the personal fat threshold, so then these leads to decrease in liver fat and decrease in pancreatic fat. This is normalization of function of beta cell mass that leads to normal glycemia. So we know that a bariatric surgery, which very well makes a person causing weight loss and causing diabetes remission. Why? Similarly, this study shows that a person with type 2 diabetes who undergo intensive lifestyle modification. So intensive lifestyle modification, that is with hypocaloric diet and physical activity, also leads to the remission. So in this study, about 46% of the people who have type 2 diabetes undergo remission with only lifestyle modification. So finally, we know that bariatric surgery showed that diabetic remission was possible. Roy Taylor explained how this diabetic remission was possible. The direct trial proved that no surgery is needed, while even a simple lifestyle modification or pharmacotherapy can makes the person undergo type 2 diabetes remission. Next, we know that what are the predicting factors that leads for type 2 diabetes remission. There are various trials which is different predicting factors. Among these, the person who developed diabetes at younger age, a type 2 diabetes with shorter duration, when at the baseline they require lesser number of oral antidiabetic drugs, or where their higher baseline BMI, they are a better predictor of type 2 diabetes remission. Among these, the most important significant predictor is duration of diabetes. When the shorter the duration of diabetes, for example, let's say less than 6 years of diabetes, they have a very higher chance of they go for remission. So as the duration of diabetes progresses, the incidence of diabetes remission also is decreases. So soon as the diabetes was diagnosed, pre-diabetes was diagnosed, we have to address the lifestyle modification and pharmacotherapy so that the diabetic remission is possible. What is the difference between diabetes remission and reversal? We know diabetes reversal means it implies that diabetes has been cured, but which is not possible. So the better term is diabetes remission. So as long as with the proper lifestyle, this diabetes remission is able to maintain. When we revert to the erratic lifestyle, that further this needs to further there's a relapse of type 2 diabetes. The diabetes remission is the preferred term rather than reversal. So conclusion, the duration of diabetes is very important. The shorter the duration of diabetes, higher is the chance of remission. The personal fat threshold, that is, a patient even with a normal weight can able to develop type 2 diabetes because of their personal fat threshold. So type 2 diabetes in India, so we have higher chance of developing type 2 diabetes even at very younger age. So what are the acceptability and psychological impact? So we have to accept that type 2 diabetes and pre-diabetes able to manage by lifestyle modification and by pharmacotherapy. So what are the practical delivery of remission, which includes lifestyle modification, pharmacotherapy. In extreme cases, we can go for bariatric surgery. Thank you. Thank you, everyone.
Thank you, Dr. Thank you, Dr. Ramiz Raja, for that
Thank you.
explanation. Our next speaker, Dr. P. Gauri, is from Kauvery Hospital, Cantonment, Trichy. She is the senior consultant diabetologist who did her MBBS from Coimbatore Medical College, followed by specialized training with postgraduate diploma in diabetology, cardiology, and echocardiography. Her academic pursuits also include an MSc in psychology, and that helps her with an holistic approach to patient care. Her role at Kauvery Hospital includes providing comprehensive diabetes management with a focus on innovative therapies and patient education. Her expertise is in pediatric and gestational diabetes, the preventive and therapeutic aspects of it, the flash glucose monitoring system, insulin pump therapy, and counseling. Dr. Gauri has also published articles on diabetic foot care, and she will now speak on lifestyle and intervention for diabetes remission. Welcome, Dr. Gauri, and over to you.
Thank you, madam. Um, Thank you for the nice introduction, and I congratulate Dr. Raja for starting the game. It was very nice presentation, extensive idea about diabetes remission and reversal. So it makes our job very easier. Having known about what is diabetes reversal or remission from the previous speaker, let me just brief you on what are all the lifestyle interventions available for doing this process. Earlier, some 5 to 10 years earlier, when people were asking us to know what, am I slide moving?
Yeah, we can see the first slide. Yeah, yes, ma'am.
Okay. Earlier, when patients were asking us, is my diabetes, will it be cured? Usually we say no. No, once you've got diabetes, you're going to have diabetes lifelong. But the research has changed, the scenario has changed. And when a patient comes to our OPD now and asks, can my diabetes be cured? We are now saying, yes, it is possible. And the people who may be able to cure or reverse their diabetes, or just one of few people who are Dr. Raja has enlightened earlier, younger age, shorter duration of diabetes, already obese. When they start their diabetes with obesity, it is easier for diabetes to get going for remission. So there is no doubt. It is not reversal. It cannot be cured. It is only remission. That simply means your diabetes stays under control as long as your lifestyle is healthier. And once you stop that, after a month or two, you're going back to have diabetes. So you keep that in your mind. So if you want to have a diabetes free life or a very good sugar control in your life, you have to follow a very strict lifestyle pattern. That is what I'm going to discuss with you in the next 10 minutes or 15 minutes. Let me just give you a simple mnemonic on what you have to do if you want to reverse your diabetes. Just have it as 5 yes. 1, 2, 3, 4, and 5. Let me just enumerate one by one. What is the first yes? First yes is sapadu. That means diet. Sapadu, when we think of it, this is what comes to our dining table, because everywhere, wherever we go, even in houses nowadays, it is not a healthy diet. It is all full of refined carbohydrate, less amount of protein, more amount of fat, junk food, all comes into the table. So your food has to be a very balanced, nutritious food if you have to reverse or control your diabetes. So the first yes always stays your diet control. You would have seen a lot of, or you would have read, or you would have listened to a lot of diet advices previously. But in a nutshell, if I want to say, like, you follow all these things, Sabrina, there are a lot of diet patterns available worldwide. Mediterranean diet, high protein diet, and recently we had this paleo diet. So many people have done so many degrees, not going to college, but they get degrees by reading lot of WhatsApp universities, and I think doctors public is knowing much about food. But in my personal view, diabetic food will be a balanced food. You should have all the nutrition which is balanced. You should have carbohydrates, you should have proteins, you should have fats, essential nutrients and vitamins and minerals. Of course, you should have a lot of water. So what I would suggest is try to have a balanced food. This is what our ancestors were having. The one which is on the outer side of the banana leaf is all vegetables, proteins. Whether it's a non-veg protein or veg protein doesn't matter. If you are a non-vegetarian, you can have non-fried, baked, grilled protein items rather than fried or deep fried items. It will increase your cholesterol also. So people who follow paleo diet, they tend to have lot of fried proteins. So you have to avoid that. You go for a grilled one or a baked one or a steamed one. So protein should be a part of your diet. It should be around 30 to 35%. Let me just give you a rough idea. When you take a plate, it's called a WHO gives a food plate. The food plate should not be a bigger one. It should be 9 inch in its diameter. So roughly 9 inch, so 20 to 25 centimeters, a round plate. It has to be divided into 4 halves, 25, 25, and 25. 25 for carbs. The carbs should mainly come from vegetables, non-starchy vegetables. And the 25 remaining should come from your proteins. This protein should be a lean protein. It can be either vegetable or non-vegetable, whatever I said earlier, which should contain egg. Vegetable protein means lot of legumes, and then you can have tofu, and then you can have paneer. So proteins 25%, carbs 25%, remaining 20 to 25% from fat. The fat you can have healthy fats, unsaturated fats rather than unhealthy, saturated fats. So ghee, coconut oils, oil things has to be reduced. Instead of that, you can take good healthy fats like nuts. You can have cashews, badam, walnut, etc. And then the remaining 25% should come from healthy fats or fruits and vegetables. So, this should be a balanced food. Now, this shows the quality of food and quantity of food. And there is another important thing. This is timing of food. This is called as chrononutrition. See, earlier we were concentrating more on this quality and quantity. And recently, in the past few years, more importance is now being given for chrononutrition. Now, what is this chrononutrition? Yes, chrononutrition is nothing but you have to time your food. The timing, frequency, and how regular you are in following this food is very, very essential. So, chrononutrition, it means what time you are taking food. Usually, what we say to our patients is we are waking at the time when sun wakes up. Sun wakes up at 6 a.m. in the morning, and sun goes to sleep by 6 p.m. in the night. So what we have to do is we also have to be active during the sun cycle. When this is like you have to work according to your circadian rhythm. Like we have a clock in our room. Our walls we have clocks. Like that, similar to that, we have an internal clock. It's called as a biological clock. It works along with the sun cycle. So when the sun wakes up, our biological clock wakes up. When the sun goes to sleep, our biological clock goes to sleep. So we have to eat, work, play, whatever we do, we have to work according to that biological clock. But ironically, nowadays we are working late at night, 11 o'clock, 12 o'clock. So when we work late night, we also eat late night. Eating a dinner at 11 o'clock, ordering something and eating late at night when we watch a second show movie. So this all has changed our balance. So if you want a good lifestyle pattern, if you want to reverse your diabetes, you have to follow this chrononutrition. So timing alone is enough. What I said is 6 a.m. You start by 6 a.m. You finish by 6 p.m. If that is not possible in your work style, you can even extend your dinner till 8 o'clock or 9 o'clock, but never beyond 9 o'clock. So what I would suggest is Like we have a 916 pattern for gold. When we buy gold, we ask for a 916 kdm gold. Like that, when you go for a diet pattern, you go for a 918. You finish your breakfast by 9, have your lunch by 1 o'clock, and finish your dinner by 8 o'clock. So this 918 will be the perfect lifestyle pattern for your weight loss program. And apart from that, frequency of having meals. See, some people, they keep on chewing something 2 hours once, or 11 o'clock, and then 1 o'clock, and then evening some snacks. So the frequency of meals also matters. See, if you have to reduce your weight, you keep the frequency to less than 3. 3 is okay, 2 is ideal. So at least 4 to 5 hours gap in between your meals. So 918 should hold good. Frequency at least 3 times. A very good is 2 times. One big meal by around 9 to 10 o'clock, and have something in the evening, a less calorie diet, and then have a 6 to 7, a good meal at 6 to 7. So frequency is very important. And then how regular you are. Having a very good diet control for 3 days a week, and then the next 3 days you eat whatever you like. It is not so. If you have to reduce weight, if you have to reverse your diabetes, be regular in your thing. And there is another entity called intermittent fasting. If we talk about it, it will take another 1 more hour. Many apps are there, many good trainers are there for advising you on intermittent fasting. It is very good. Intermittent fasting is very good. You can follow either 16 hours fasting, 12 hours fasting. There is even extended fasting times. But keep in mind, rather more than quality and quantity, timing is also important. So this stands for my sapad. Next comes my second S. This is going to be surusurupu. I don't know whether how many people are.
Ma'am, may I interrupt? We'll have to little bit rush through because we have one more speaker and then questions.
Yeah,
It's
yeah,
already
yeah. I'll
past.
do it. I'll do it.
Yeah.
Mine is going to be just 5 slides. So second S is surusurupu. Surusurupu means all sorts of activities. There is no one size fits all for everybody. You can choose your exercise, which can be either a simple aerobic exercise. You can go for resistance exercise. The resistance exercise is very good. At least 2 days a week, if you follow resistance exercise, you can build up your muscle mass. That will bring down your insulin resistance. That will bring down your fat accumulation in your visceral organs. That will improve your chance for going in for diabetes remission. So these are all the multiple benefits of regular physical activity. You can sleep better, you feel happier, you strengthen your muscles and bones. And the third S is slimming. This is what the previous speaker was telling. Everything about slimming. See, weight reduction, it brings down your diabetes, you bring down your weight, the fat accumulation in your liver, your pancreas, and all your internal organs. The visceral fat goes down. Once you lose your weight, at least 10 kg of your weight, your diabetes control comes down very drastically. You will require only 50% of the drug which you were taking earlier. And if you are in the early stage of diabetes, completely the treatment part can be stopped. And the fourth is sleep and stress. Sleep and stress plays a major role not only in diabetes but in your hypertension, in your dyslipidemia, in your cardiac things. Entire metabolic syndrome can be corrected by following a healthy sleep pattern and a healthy stress management. There is a lot of things available for reducing your stress. And in the current scenario, everybody is stressed, not the adults, even the school going children are stressed. So try to follow all these activities to reduce your stress. And the last fifth yes, which I would like to specify is whatever you're doing, diet pandro, exercise pandro, like you're so involved in your diet, you just follow it for 2 weeks, 3 weeks, then you take a holiday, go for a vacation, all just collapses. So if you want to go for remission, your effort in lifestyle intervention should be a sustained one. Not only sustained, it should be systematic. Please get an advice from a doctor, get an advice from a healthcare professional to go in for diabetes reversal. This is what we in Kauvery Hospital do, a diabetes reversal program. There are a lot of diabetes reversal programs available in the net. Some are free, some are paid one. We have started a new innovation in our Kauvery Hospital. It is totally free of cost. What we have done, we just 3 months, we give a free of cost. There is no cost for participating in this program. It is a Zoom program. People can participate from anywhere, from their home. They need not come to our hospital. It is just weekly once a Zoom call. We give everything. We give a basic diet pattern. We give them a tailor-made exercise regimen, whatever is available to them. It is more personalized sort of things. Each one can give their own advice with the comfort of staying from their home. They can utilize this opportunity. We treat diabetes as a whole: diet, exercise. We also try to bring down their stress and sleep by giving meditation exercises. This is called body scan meditation, which we teach them how to do, and they can do it in a daily basis at home. They can even join with their entire family. I've given this in Tamil so that people can utilize this, and we have a helpline number also. If they want to join in this program, they can call this number. The enrollment is totally free. 3 months we will travel along with them. We will teach them how to take care of their diabetes, and people earlier duration of diabetes, they have totally gone into remission. People in the later stages of diabetes, they have come down in their diabetes management. Requirement of insulin tablets have come down by more than 50%. Yes, and thanks for the patient listening.
Thank you, Dr. Gauri, for giving those valuable lifestyle tips and inputs. As we move on to our third and final speaker for today's webinar, I would like to request our audience to start posting their questions in the Q&A box, which is open for you. Our third speaker, a senior consultant in diabetology and general medicine from the Alvarpet branch of Kauvery Hospital, Dr. K. Bharanidharan, is known for his clinical expertise, decades of patient trust, and holistic approach to managing chronic illnesses. With a deep-rooted understanding of metabolic and systemic disorders, he has played a pivotal role in helping patients manage diabetes and its complications with clarity, compassion, and long-term success. He is particularly sought after for his individualized diabetes management plans, combining evidence-based medical therapies with lifestyle modification strategies that deliver sustainable results. His proficiency also extends to handling complex multi-system conditions such as hypertension, thyroid disorders, obesity, and metabolic syndrome. Respected by both peers and patients, Dr. Bharanidharan is often the physician of choice for long-standing medical issues and preventive health consultations. He is a firm believer in empowering patients through education and builds lasting relationships rooted in trust. Dr. Bharanidharan's areas of interest are comprehensive management of diabetes type 1 and type 2, complication control in neuropathy, nephropathy, and retinopathy, hypertension and dyslipidemia management, thyroid and hormonal disorders, obesity, lifestyle and metabolic syndrome care, infections and preventive health screening, elderly care, and lifestyle counseling. Dr. Barani's presentation is on technology and medical management of diabetes. Over to you, sir.
Thank you, madam, for the wonderful introductions. Vanakkam, good afternoon to everyone. So, share my slide.
Yes, sir.
Can you give permission to share?
Yes, sir. Please go ahead.
It's disabled. Okay. I cannot share. I think you have to give permission to share. Okay.
Done?
Yes, now I get it. Okay. So you're able to see my slides? Okay. Can you able to see my slides?
Yes.
Okay, fine.
Yes.
Thank you. So thank you for the wonderful introduction. I really appreciate Dr. Raja and Dr. Gauri given a very good platform about the physiology and pathophysiology and also lifestyle modifications. Now my role, as it is now we understand diabetes reversal and remission, all those things. What is the role of technology and also the medications in managing diabetes, so reversal also? So basically, we understood about what is diabetes reversal and diabetes remission. I'm not going to take much because my talk is more about the technology and the medications part. So diabetes reversal or diabetes remission is possible only in type 2 diabetes. It's not possible in type 1 diabetes. That people should understand. And how it is able to managed with remission, yeah, we have discussed. So basically, how this diabetes reversal is possible is main thing is about the weight reduction. So people with obesity, Dr. Raja was discussing about the obesity, people gaining weight and then developing insulin resistance. People with obese people, if they lose almost 15 kg, that is almost 10% of the weight reductions from their existing weight, there is a chance that they can go for a remission state. So the weight reduction is a lifestyle management it's possible. And you should understand diabetes remission if they maintain the HbA1c less than 6.5 without diabetic medicines for last 3 months, then they are going to the diabetes remission state. And long-term diabetes remission is what we are thinking about diabetes reversals for a longer term. That is the thing. So how this diabetes reversal is possible? What are the science-based strategies? So how we talk about previously, when it comes as such, Madam says diabetes, we can able to control, or when you detect diabetes, 50% of the beta cell is gone. So there is no cure for diabetes. But after Dr. Roy Taylor, Dr. Raja was discussing delicately about the direct study done by Dr. Roy Taylor about how this weight reduction alone and the calorie restricted diet, which is helping them to do much some of the changes in our system to bringing the people who are suffering from diabetes to the diabetes remission stage is by all these science-based strategies. One is the reduction of fat inflammation, which Dr. Raja has already described, and also improve the muscles, the fat ratio, and customize the diet, enabling the better glycemia. It is individualized and remote monitoring of the blood glucose that I'm going to discuss today, and what are the advanced interventions when necessary for people with diabetes. So now, simply everything is become smart. So nobody is people are having without any mobile the smartphone. So treatment managing diabetes, managing pre-diabetes or bringing diabetes remission is also smart. That is, when you talk about smart, it should be specific, measurable, achievable, realistic, and time bound. So basically, it should be individualized. That is what the thing. Strategy for reducing the fat inflammation and reversing diabetes was discovered by Dr. Raj, because how the fat plays a role in just developing insulin resistance and all inflammations, which is causing more metabolic illness like not alone diabetes and also increased cholesterol and then causing cardiovascular mortality also. So there are a lot of ways which can we can reverse this fat inflammation by weight management and bringing the glycemic control, regular exercise, and correctly the anti-inflammatory diet. What we're talking about, reducing the inflammations which is causing insulin resistance, and more than that, sleep and stress also described by Dr. Kauvery. So all these things which is going to help. And main thing is the muscle fat ratio. So as we age, we should know that actually we are losing the muscles. What we are developing is called the sarcopenia. So that the function of insulin is also getting reduced, because if there is the muscle mass is not good, the insulin uptake is happening in the cells in the muscles. So that muscle loss will definitely going to increase insulin resistance, and increasing the muscle mass is going to help, and losing the body fat will help in improving the insulin sensitivity and going for diabetes remission. And customized diet, I'm not going to detail, because actually changing from unhealthy to healthy diet, reducing the processed fat, and going for a real diet is going to help in reducing the diabetes to diabetes remission stage. Now, coming to my talk about the regular monitoring of blood glucose. What currently we use technology is called the continuous glucose monitoring study, what is called CGMS. This is a small sensor which we just put in the arms of the patients, where it monitor the blood glucose and the readings comes to the smartphone. So once patients or anybody who just want to be health conscious, or sometimes those people want to reverse diabetes. So first thing is without monitoring whatever the lifestyle changes or like diet and exercise they're doing. So how it impacts in the glycemic level is very important. So to actually manage the glycemic level effectively, they need a monitoring. So the continuous glucose monitoring will be the main tool, and they can easily because whatever the diet we talk about, low glycemic or high glycemic processed food or things, whenever they take the diet, they understand how this diet impact blood glucose level. They can immediately see the spike in the blood glucose, and not that they can whatever the readings they are seeing, the doctors can monitor the blood glucose from the remote. This is one thing what we called as a real time continuous glucose monitoring. So immediately the doctors, so who is managing the pre-diabetic stage or diabetic stage, they can see the spike or going down, why it is happening. Accordingly, they will just advise the diet pattern and the physical activity, and also even monitoring for regularly to just to see how it is settled. This is called the real-time continuous glucose monitoring. So where the sensor is fixed in the arm, and the readings are immediately captured in the Bluetooth to the mobile phone. So they see the readings pattern, like it is showing 112. This is normal range they are just giving. So continuous glucose monitoring, it is the new way of monitoring the blood glucose continuously, and it can be fixed for one time for almost 15 days. Currently, we can just monitor for every 5 minutes once. So they can see the readings day through day and night. So this is a blood glucose. Actually, how it is different from the traditional blood glucose? The traditional blood glucose is what we call as a self-monitoring blood glucose, where people use a glucometer and then they monitor the sugar level whenever they want to check the sugar, whether it is going down or high, whenever they feel giddy. But continuous glucose monitoring is the one which continuously monitor the glucose level, and it will be there for 15 days, so that they can have a lot of pattern which we'll just analyze. So this is how the trend, which explains about the current glycemic level and how the pattern for almost the 24 hours we are seeing. And one thing, what a physician gets in this is nowadays we are very much focused. What I say is about the smart managing. So smart management in the sense like how much of target for the blood glucose. So if people want to reverse, so nowadays actually people in pre-diabetes or even in diabetes, or they want to reverse the state, they want to check the 24 hours glycemic pattern. So the continuous glucose monitor will identify the time in range. There's a concept what how much of blood glucose. This can be individualized for the patients, so we can set the target like a 70 to 180. But for pre-diabetes, for people who want to reverse these conditions, they have to just adjust the target and see how they are achieved. And with that, we can just tailor the dosage, tailor the lifestyle patterns to reverse the condition. So when you look into medical management actually, even people they have a pre-diabetics. As such, Dr. Raja was saying that when you detect diabetes, so the beta cell function is gone. Nowadays, newer medication has come, so which helps in not only bringing the glycemic levels, but also helping in improving the heart and the kidney also protections. So some point I just want to discuss. This is one thing called sodium glucose transport inhibitors. This is a new molecule which is discovered for bringing the glycemic control for glucose control. That helps in improving the heart and kidney protection also. So there are a lot of benefits in this molecule. So not alone lowering the blood glucose, there is a mild weight loss also with this molecule, and especially it reduces the visceral fat. There are a lot of studies. So the visceral fat, the organ fat that is causing the deposition of fat in the liver and then the pancreas, which is causing insulin resistance, that is causing diabetes. So when this molecule we're using in the early stage of diabetes itself, it is going to reverse the visceral fat, helping them to just going for a normal glycemia. And then the main factor is the non-alcoholic fatty liver disease. The fatty liver is the one which often we see here. So that also will be reduced with this molecule, and there is a mild reductions in the blood pressure, and then the cholesterol, and then there is a decreased uric acid also. So more than that, it molecules helps in heart and then the kidney also. This is a newer molecule which is going to have a game changer in diabetes. Already we are using this molecule in patients, and we are seeing a lot of benefits with this molecule. And one of the other molecule which I'm going to discuss about the GLP-1 analog. This is a very simple peptide, which is a protein which is there already in our gut. So we call this GLP as a glucagon-like peptide. It has actually a main role in managing type 2 diabetes. So it's an incretin hormone, we call as such. We will this helps in reducing the blood glucose, and also it helps in the brain serenity centers. So where it helps in regulating our blood glucose, not only blood glucose, and also the appetite regulation is also a thing. So people will after taking these medications, they feel that there is an promotes a feeling of fullness. By the way, they don't take high calorie diet, so that helps in promoting the weight loss, when this molecule they are using. There are a lot of GLP-1 analogs has been coming to the market. So like newer molecules, what we are listening here is dual GLP-1 GLP analogs, which can be taken once a week, and we are seeing benefit with these patients with these medications. If they actually, we have seen people with the pre-diabetic or diabetic, so chances that the HbA1c become normal, and we need a long-term study about these molecules, how it helps. People can go without medication also possible, so with the proper lifestyle interventions when you use this molecule. Now, to understand better who will benefit with the diabetes remission. That is what the ideal term instead of a reversal. So the pre-diabetes who are willing to adopt to a healthier lifestyle. So definitely we can use this molecule, and we are seeing the people going for a normal glycemia, bringing the HbA1c to less than 5.7. With a diet and lifestyles, after taking these molecules, they can just maintain the healthy lifestyles. They can have a long-term remission is possible. And also people the new onset diabetes or with a duration of 5 years. So this is the same thing group in direct study Dr. Reiter used with a calorie restricted diet and also with the structured physical activity. They have been followed. There is almost a good number of people weight reductions for a longer duration of period also. And also there are a lot of doubts comes to the people with a longer duration of diabetes. Those people, patients with a controlled diabetes with a compliant medical therapy, definitely with the help of physicians, they can even go for reductions in the medications. Some people, even with the motivated people, they'll definitely have the chances of diabetes remissions, at least for a shorter duration or even for a longer duration, is also possible. So currently, there is a positive things which is here because today we are hearing about diabetes remission. This is not happening previously with a lot of science behind it and a lot of newer molecules. Definitely, the technology also helps in improving the quality of life of the people suffering from diabetes, from pre-diabetes to the established diabetes. Without the help of the patient's motivations, we cannot achieve these things. Thank you so much. I end my talk with this. Though before that, I just end the pillars of diabetes reversal is always the diet, the exercise, and also the advice from the medications from the physician and regular monitoring. This will help you in moving from pre-diabetes or diabetes to the diabetes remission or even diabetic reversal for a longer time also possible. Thank you.
You are muted, ma'am.
Sorry. No, what I was saying that thank you, Dr. Bharani, for your presentation. And also, I mean, though all the panelists have touched upon reversal and remission, I think there is still a lot of confusion among the people from the questions that we have received. And I'm just randomly picking up one or two from Karthik and Renu Wise, who are, so the basic idea is to convey that diabetes cannot be cured. But when we say diabetes can be reversed, does that mean that it does not necessarily mean cure, right? Because does it mean that people can totally go off medication and lead a normal life? And if not so, then I think isn't remission a better word? Like, what is really the difference between reversal and remission? I mean, how long can a remission be? For how many years can a patient remain in remission? Reverse, and does reversal
Remission,
reversal
reversal,
mean that it
cure,
is
all
cured?
play of words. It's just play of words. What I would say is your sugars are under control now. If it is without medicines, we are very happy. But you have to continue a healthy lifestyle lifelong. I would say this is not just for a diabetic person, for any individual, for any public person. If we follow a healthy lifestyle as our ancestors were following, it is good. So it doesn't mean that reversal is wrong, remission is correct. You know that you have got diabetes at one point of your lifetime. So why do you have to go in for it again? So be under control. Follow a healthy lifestyle. So you have reversed your diabetes. From a higher level, you have come down to the normal range. You have reversed it. You stay in that stage itself for a longer time. It depends on how consistently you're following the interventions for reducing weight. Like we have seen people off medications for at least 10 years. I've seen in my practice. But lifestyle intervention, it has to be there lifelong.
Right. Because I think people also become very drug dependent. And though everybody understands that a healthy diet is a safe way to manage or control diabetes. But so another question is about, like when is the right time to go off medicines? I mean, whether can a diabetic patient be really off insulin? I mean, these are all repetitive because the same points will keep coming back. But then I think we have to reiterate the message also clearly. So, Dr. Ramesh, you would like to explain once again?
Well, actually, the indication of insulin is varies actually. So when the duration of diabetes is very advanced, for example, when a patient with the type 2 diabetes more than 15 years of duration, because of the innumerable progression and the beta cell exhaustion, there is insulin deficiency, they require insulin. So they incur some amount of insulin for long term for maintaining diabetes under control. That is like glucose under control. Whereas in a early stage of diabetes, when the sugar is very high, for example, in the early stage of diabetes, the sugar is very light for HbA1c is 11, 10 or 11. The insulin may be given for a shorter period of time, which will address the glucolipotoxicity. So it will reduces the blood sugar so that the beta cell will recover. The beta cell recover so that we can make the patient to stop the insulin later. Then we can advise to follow the lifestyle. In addition, also if needed pharmacotherapy to maintain the glycemic control.
Dr. Bharani, like, like yes, one of the presentations also mentioned that not every obese person could be a diabetic. But if you have these, if people have the symptoms, like whether it's high BMI or obesity, what is the right age when people should start, at least kind of try to go for the tests?
Currently, actually,
Find out.
diabetes, we thought it comes in the fourth decade, but currently, because of the lifestyle, we are getting young onset diabetes. We are seeing people with 20, 25 ages itself where they are getting diabetes. So it is better after once they enter just finish the college, they're going for the office immediately. They have to just check the metabolic profile. So not only the sugars, the cholesterols, the blood pressures, all those things they have to monitor. I recommend that at the age of 25 itself in India, actually, because Indian phenotype, they are prone to get diabetes at their younger age when compared to the Western. So it is better because of our availability of high calorie diet, high carbs in our diet. So we are on less physical activity and more stress and sleep patterns is disturbed. So better at younger age, it's hit early. So better if they start financially, like going for work immediately, they have to consider taking care of the health. So always the same thing. Health is always wealth. So better start earlier. Earlier itself, we don't check.
So there's also confusion about diet. Every people have too many questions about what they should take, what they should not take, what is a fruit diet for a diabetes, whether ghee is healthy or not. Then Dr. Gauri, you talked about this intermittent fasting. So the effectiveness of prolonged fasting, does it kind of haste remission? So could you? I'm just combining questions because there's not much time left.
Okay. So the one thing is there is no rule for a fad diet in diabetes things. So there are a lot of things. So there's a balanced, nutritious diet. What we tell is low calorie, low carbs, high fiber. We talk about fiber first. That is what very important things. Now we are talking about the gut microbiota. So in the future, what going to be another mechanism of getting diabetes is disturbed the bacteria. That is the causing the inflammation and the insulin resistance. So we have to include more fiber in the diet and high protein in the diet, and also along with the diet, the physical activity is also going together to get it from the insulin resistance and improving the insulin sensitivity, preventing diabetes also.
So there is a doubt by Brinda Vijesh who's specifically asking whether it is intermittent fasting is really safe for diabetic people with diabetes, because she's a practicing dietitian and she does recommend intermittent fasting, but there are studies which say that long-term intermittent fasting leads to gallstones. Is it true, Dr. Gauri?
It is not like so. Intermittent fasting is good for people who are on lifestyle medicine. I mean, lifestyle alone, if they are following, it is good. If they are on insulin, if they are on tablets which will reduce sugars in between, they have to take meals in between to prevent sugars from going down. So, intermittent fasting is not good for certain people. So we cannot just like that give a blanket approach for everyone. It should be an individualized program. Whoever can tolerate sugar levels till what level. So a fasting of 8 to 10 hours. Say they finish their dinner by 8 o'clock, get up in the morning till 8 o'clock. That is a or average. Everybody can follow that sort of thing. But 16 hours fasting and a prolonged fasting is not advisable for diabetic patients who take many medicines, who are cardiac failure patients, renal failure patients. They have to be on proper diet in between. So I would not advise intermittent fasting for everyone. It is individualized. One thing. And the second thing, which gallstones, prolonged fasting, if they are able to drink enough amount of liquids in between, I don't think it is related to gallstones.
Also,
So one,
this, sorry, yes, please.
one more
Yes,
point I just want to one thing like calorie restricted diet. So instead of intermittent fasting, time restricted diet is also a concept in diabetic patients to help. So we have to think about that instead of intermittent fasting, at least we should have time restricted diet that will help in metabolic wellness.
So the point that you mentioned 618, sorry, 918,
Yes. Yes.
Dr. Gauri. So now people are also confused about earlier doctors would say have small meals, eat 5 times a day, but you are now suggesting 3 meals, big meals.
I'll
So
tell you. I'll tell you the reason behind it. See, when we take some drugs which may cause some sort of low sugars in between the two main meals, earlier we were advising to take something as snacks in between. But there are right now many molecules available which will not cause low sugars. They are anti-hyperglycemic, but they are not hypoglycemic. When you are on those drugs, there is no need for taking a snack in between. So in between snacking is not needed if they are on anti-diabetic drugs, not on hypoglycemic drugs. Anything if other speakers want to add on snacking? Because right now I am not advising snacking for all my diabetic patients.
So again, one thing, if you just ask them to have a frequent meals, that is also going to have an high insulin spike. So again, we have to just think. So most of the time, then patients will be like in a postprandial hyperglycemic state. So that also we have to just keep it. That is the reason now the technology helps the continuous glucose monitoring. So if you just we can adjust the diet pattern also. When you do this study, we can understand what type of diet they are taking, how is a glycemic levels are going up and down. What we call this a glycemic variability, whether it is going down or high. Accordingly, we can just tailor them for proper nutrition also. So these tools really helps us in adjusting the diet pattern also, so that we can tell them the frequent snacking is also not necessary, and it is also individualized. Not one thing fits for all. We have to individualize for each patient.
So somebody has diabetes for 20 years and wants to know how does one identify it is whether it is due to insufficient insulin or due to insulin resistance.
So it's
You
okay.
can check
Simple.
their
We can,
C-peptide
yes.
levels.
So we can just simply do a blood test called C-peptide, and also we can see the insulin assay, what we call as in the fasting stage, and also fasting blood sugar level. With that, there is a simple formula called a homeostasis assessment scale, HOMA-IR. So with that, we can say how is the pancreas insulin secretion is working. So with that, we can just determine whether the patient is having a type 2 diabetes or a type 1 diabetes, or even when they have a longer duration of diabetes, whether the insulin secretion is going down. With the simple test, C-peptide, they can just analyze.
Which fruits are a total no-no for diabetes? The people with diabetes.
No, no, man.
No, it's for anybody.
Absolute
You
no
have to
for
enjoy the richness and taste of all the fruits, but fruits in moderation. Fruits, you can have it as these fruits should be taken in a lesser quantity. These fruits can be taken in a higher quantity. I would not say a no for a mango, even for my patients. So you should have to identify your sugar levels, whatever you've eaten across, I mean, along with that. Then how much fiber the fruit contains. We divide the fruits as low glycemic, medium glycemic, and high glycemic. Once a while, they can have high glycemic fruits, and regularly they can have low glycemic fruits.
so with a lot of these
Some of,
forwards. Yes, sir. So were you saying something?
some of the fruits they can take at any time, ma'am. Like they can take apple, orange off your pot of orange, they guava, that is partially ripe guava, papaya. They can take its liberal quantity. But preferably the portion is a key. Some moderate portion they can take at even in daily every time.
Yeah, I think moderation is the key. Somebody's also asking in the 918 schedule, can we also snack in between?
If
So
sugars
it's
are going down, they have some hypo symptoms. And another fruit I forgot to mention is avocado. Avocado has a very low glycemic index. It has good fat, so we can try on avocado. Now it's available widely,
but an
commonly called as butterfruit.
yes,
Butterfruit
yes,
is, yeah, it's good.
but quite an
So,
expensive fruit.
so we can advise for like mid morning and mid evening snack. So 11 o'clock and 4 or 5 o'clock plus snack. So this snack is predominantly contain protein or it's predominantly contain its complex carbohydrate. So what is the rationale behind taking this mid-morning snack? One thing is to avoid hypoglycemia in a patient who are taking insulin. The another thing is when we take that 11 o'clock or 4 o'clock, so that we can take a lunch or a dinner, we can take in a smaller quantity as our stomach is partially full at any time. So that we can take a lunch and dinner in a smaller quantity. So that the peak blood glucose, because postprandial blood glucose, a profound hypoglycemia, which does not occur.
Right. So now with a lot of WhatsApp forwards, and somebody's saying that there are too many what diabetes reversal programs which reach us, and then people also go to Ayurveda and maybe try homeopathy. And so this combination, whether that is kind of harmful in any way, and of course we all understand that one should not do self-medication in any way. But then if people combine, so does that kind of is that harmful for the patient?
Actually, there is many program is there based on this diabetes remission is based on the simple key, that is weight loss. So weight loss occurs through a balanced diet with a low calorie diet with associated with a good physical activity or exercise, which will makes the person with the type 2 diabetes to go into remission. So with the regular glycemic monitoring. If needed, we can go for pharmacotherapy like GLP-1 agonist, which can cause a good amount of weight loss.
Right. I think there are too many questions on fruits and food actually. But I think we'll have to wind up. So tomorrow being the World Diabetes Day, I would like all three of you to give your say 1 minute message.
You should start
Not
first.
30 seconds, yeah.
30 seconds. Okay, so let me wish all of you and let me pray to God that all of us will lead a diabetes free life in the future. And for those diabetic patients, let them all have a good glycemic control without any complications, and let us all live happier, healthier for a longer time.
So,
Thank
as a
you.
physician, actually, we think diabetes is something like India's capital. We have to change as a diabetes care capital. So, we have to make people healthy and help in just reversing possible in a scientific way. So, we have to make better quality of life. Health is always wealth. So, there is a
Always the screen for diabetes so yearly. So yearly screening of diabetes and give the proper addressing the diabetes very early, so that diabetes come under control. So we can follow the six pillar like diet, that is physical activity, then regular glucose monitoring, then that is diabetic education. In addition, the adequate sleep management and stress management. So all these to be necessary for proper health being.
Yeah, so I think perhaps it would be safe to say that it is possible for all of us to go into, for people to go into remission if you're in a pre-diabetic stage or you're in your early diabetes stage, maybe the first 1 or 2 years, and then delay progression into early stages of diabetes. I mean, I think at the end of it, it depends on every individual's determination to strictly follow diet and exercise schedule. Both are healthy ways to manage diabetes. And as they say that if you want to do it, you should be able to do it. So thank you everybody for joining today's webinar on diabetes reversal. Is it possible? Presented by Kauvery Hospital under the Hindus Wellness Series. Thank you, Dr. Gauri, Dr. Bharanidharan, and Dr. Ramiz Raja for sparing your time. And thank you, audience, for the questions you sent in. Thank you all.
Thank you.
Thank you all.
Thank you, everyone.
Off.